You're welcome, Doc.
Yeah, you are welcome.
We'll be talking about asthma today.
Okay.
My first question to you is: I would like you to tell us how asthma affects people.
Well, what is asthma in the first place? That's what we need to know first.
Okay.
Yes. Asthma is the narrowing of the airways that go into the lungs.
Okay.
Yes, and this narrowing is brought about by inflammation of the airways called bronchi that take air into the lungs when you breathe. So when that narrows, there is difficulty in breathing, and that is what is called asthma.
Okay. But what are the causes of asthma?
The causes of asthma, well, there are several. But first, you have the hereditary type.
Okay.
And then secondly, persistent exposure to what we call allergens. Substances that are allergic to the human body.
Okay.
Yes. So when somebody is persistently exposed to some of these allergens, there is a tendency that that person will develop asthma.
Oh,
And there is no age at which asthma can start. It can start at any period of somebody's lifetime, whether in childhood, in adulthood, or in old age.
So it can happen to anybody at any time.
It can happen to anybody.
Please, you talked about
depending on-
some allergens.
Yes.
Can you mention a few of them?
Well, the allergens, you have several of them. You have the indoor allergens, which is, allergens which you get inside your house, like dust when you sweep and dust rises. You have these spores, and you have even cobwebs, when you breathe them in. These are some of the allergens. And you have outdoor allergens, like pollen spores from flowers.
Okay.
Yes. And then air pollution, from, exhausts of vehicles,
Something is just coming to my mind now. You talked about dust. Can powder cause asthma?
Of course, it can cause, if there is persistent exposure to the powder over long period of time, breathing in, because it is also in a dust form, and
Okay.
it has chemicals inside.
Okay.
The powder is made of chemicals, and when your body is being exposed persistently with that you have been breathing it, there's always the tendency that it can cause asthma.
Okay.
Yes.
Is there a cure for asthma?
There is no cure for asthma. There is no cure. You can only control asthma, but no cure.
What are the symptoms of asthma? Let's say I have a little child and I'm seeing some behavior that I'm not convenient with. How would I know that, this child is actually suffering from asthma?
The symptoms are, labored breathing. That's the most important of it all. And it's characterized by a wheezing sound, which you cannot mistake at all. Like somebody whistling coming out of the chest. That's why we call it a wheezing sound.
Okay.
Yes. And there is nausea. Sometimes there will be cough and then vomiting. These are some of the symptoms associated with asthma.
All right.
Yes.
Is there anything a chronic asthma patient can do before getting to the hospital to save their lives before getting to the hospital? In case, I know of course that asthmatic patients, they use inhalers to sustain themselves, but in case of there is no inhaler anywhere, is there anything such a patient can do to get before getting
Well,
to the hospital?
that is a very precarious situation, because that is why we always advise asthmatics to carry their inhalers wherever they can, because the attack can come at any moment, and it is very essential that you have that inhaler, which will bring relief immediately. But in a case where there is no inhaler, what we advise is to lie down the patient, let the patient remain calmly, very calm, and then taking sustained breath in and out, and immediately rush the patient to the nearest medical facility.
Okay,
Yes.
thank you very much,
Thank
Dr.
you.
Charles.
It's a pleasure.
We'll be happy to see you next
Thank you
time
very
on this
much.
channel.
Thank you.
Thank you.